And again, when we talk about progress, a big part of that is around pricing. And we want to certainly make sure that everyone understands how a lot of the biggest life science companies are utilizing pricing strategies and deriving those pricing strategies using digital health technologies. And that was a big part of Vive and HIMSS this year. They were people that were there trying to understand how pricing in digital health and digital therapeutics is being developed. And so someone who's an expert in pricing strategies and how these are developed in general therapeutic areas is a special guest of ours today from Abbott, and extremely glad to be able to welcome someone who's been around the economics of pricing and life sciences for over a decade, Ram Subramanian. Ram, nice to see you. Thank you for joining us today.
Yeah, thanks for having me. Really excited to be here for this one.
And the audience is excited to see you as well. Obviously, it's the last 10 minutes of the program. We still got a ton of people listening all over the world and very interested in hearing what you have to share about pricing strategies. And again, audience, we've got open chat box, open Q&A, and Ram, Jerry's going to share your LinkedIn page, so you'll get LinkedIn requests from folks from all over the world as well to connect with you offline. But really, and if you're in the audience, again, feel free to light up the Q&A box or the chat box with questions about pricing and questions around what kinds of pricing strategies we should be using in digital health, learning from some of the best and the brightest in life sciences to begin with. But to start off, Ram, if you could just tell the audience a little bit about yourself and your role at Abbott.
Yep, thanks, Stan. Yeah, I'm Ram Subramanian. Good afternoon, good morning, everyone, where you are. I've been in this field on pricing for the last 5 to 6 years. Started my career with Johnson & Johnson, doing pricing strategies globally for their surgery, the Ethicon business, orthopedic business, DePuy, and then the cardiovascular. And over the last 6 months, I joined Abbott to start the pricing transformation and the digital pricing excellence journey at Abbott for the US EP business. So my career has been in the healthcare field. I started off working in a hospital, Stan, and then pharmaceutical side. But over the last 5 to 6 years, it's been heavily focused on medical devices and pricing specifically for med devices.
It's fantastic. And going back into some questions now and getting really dialing up a little bit more about how these pricing strategies can be applied to digital health. Let's bring it back to what you're seeing as pricing transformation within the life science medical device industry. Talk to us a little bit more about that.
Yep. So really what we are seeing is a multiple of factors that's actually driving this pricing transformation journey, right, Stan? If you look at from a healthcare standpoint, there's a lot of focus, as you know, on triple aim, reducing the hospital costs across the board, and significant challenges in doing that for med device companies. So we always get crushed, right, on pricing. We want better pricing because the facilities want to lower the cost of doing business. And there's a lot of power dynamic switching, right, from what used to be the physician preference based to now it's going to be mainly driven by supply chain. So supply chain is controlling. So there's a shift in dynamics and power struggle, right? So most of the power now is moving towards the economic buyers, if you may will. So second biggest challenge is price transparency, right? With digital everywhere, there's so much data across hospitals. So they start benchmarking you and comparing you and saying, hey, these are some of the similar prices. So we need to match the prices. So they are getting sophisticated with a lot of data that's in their hands. And then the next key driver we are seeing is hospital consolidations, right? You have a big hospital taking over smaller hospitals. So if you don't have the price discipline where if you have a small hospital getting best pricing, guess what happens when you get eaten over by the big IDNs? And we've seen it across in my previous experience. And here, it's you have to match the price, right? And they start rationalizing the price. And same is the trend OUS as well. There are big partnerships between Ramsay Ascension, right? Cleveland Hen Clinic going OUS. So now there's going to be more price exposure across countries. So Germany having the lowest prices, and if there's a merger, they're going to ask for price matches, right? So that's the second biggest driver for pricing transformation. The third one I would say is, as you mentioned, digital health, digital transformation. So most of medtech, as well as, and as actually recently Johnson & Johnson changed their medical device to medtech, because most of that is medical and technology. It's so much data being collected at the point of care. So the companies are trying to leverage and say, how do we monetize this data, right? How do we come up with new business models, new revenue models to monetize data, right? And lastly, it's margin pressures. I mean, any big corporations has to make sure that we have a growth which is growing profitably. So a lot of focus on maintaining margins. So those are the key drivers and trends that we are seeing in the healthcare space, which is driving towards more of a transformation.
That is something else. And I think a lot of digital therapeutics executives and a lot of folks that are watching this program all over the world that are buying digital health products as well, or investing in them, they really want to know about that. They want to know what's driving and what can drive digital therapeutic adoption into health systems. And so one of the things that one of the audience members wants to know a little bit more about is why are we focusing on monetizing the data and not using them to drive clinical outcomes? Or is that just not necessarily a focus on monetizing data? Is it one of the kind of a sub-focus?
So monetizing the data, I would say, is the outcome, right? But the really key driver is value. So how do we now quantify what is the value that the data brings for the facility, right? What are the outcomes that it's generating, right? How does the data help the physicians improve their procedures? How can they get better? How do you benchmark against other peers, right? So those are some of the factors we consider as how are we adding value to our customers. So when we talk about pricing, it's based on the value that we add and how is it economically impacting the physicians or the hospitals, right? Are we reducing the speed to market, right? Are we reducing the procedure times? Are we improving efficiencies? Are we helping the physicians get it better? So those are the key drivers that go into factoring for your monetization of data. So that was a great question. So those are some things that is very important.
Brilliant. And that's, I think that's a really good way of putting it in terms of how that actually works within the system and how it would work. So give us an idea how we can use pricing as a lever for profitability. That's something that you certainly looked at closely in a lot of your modeling.
Yeah. So again, from a pricing standpoint, what we see is most of the companies know, right? Pricing is the most important lever for profitability, right? There are, as you know, if you want to grow, it's either through revenue or reducing the costs, right? So price is a very important lever, and we say it's important because a small change in price can significantly impact the bottom line faster than reducing costs or increasing our volumes. So really, that's what we see. And in pricing, we see there are three different pillars, right? It's I saw a chat box coming about quality of care is important. So that's where we want to focus on is how do we come up with the right pricing strategy that's related to value that we're adding, right? How does it impact our quality of care for the physicians? How is it impacting our ability to provide the best care for the patients, right? How is it impacting the hospitals, right, from an economic standpoint? So developing more robust pricing strategies based on value is something that's most important. Third is life cycle pricing, right? How do we make sure that for our products that are in the life cycle, how do we start segmenting and coming up with better strategies, right? So those are the second. The second pillar we see is on the execution side. How do we make sure we use a lot of robust data to segment our customers so that similar customers need to get similar prices? So how do you incentivize the big customers, right? And provide them a way to achieve more discounts versus the smaller customers. And lastly, pricing is an important lever is through having more robust process and governance, like just like how you manage your revenues, you need to manage your price as well for a company. So those are some of the trends that we are seeing on how pricing can help. And then in terms of digitization and the new models, all of pricing is based on facts, right? So you have tons of data that's available now. It's internal through SAP systems, your competitive information through third party. You have your contracting systems, you have procedural information. So all of those go into actually coming up with a robust pricing strategy, right? So those are, I think, the pillars of what makes a great pricing organization.
Okay, and I think that does make a lot more sense to to the community as we start dialing that up a little bit. We've got a question coming over from a colleague of ours from Ames in India, and obviously wants to know, how do you see digital health disrupting local setups, especially labs, and how can they sustain their businesses, particularly within the kind of the pricing strategies that you're talking about here?
Yeah, I mean, the digital health is in fact, I think what we see is, even in our space, we see it as an opportunity, right? So the way we see it is, how can we use digital as a means of adding more value, right? Especially around our space, we're looking at how remote support, right? Currently, there are people supporting cases with the physicians, especially in our business. We need to have a clinical rep with the physician in every single case. So we are looking at different models of, how can we improve our productivity through remote support, right? Or telehealth. So we see those as opportunities to say, better coverage from a standpoint, right? So can we provide greater coverage for the physicians remotely, right? Maybe in India, right? Or in other parts of the world. So I think we see those as opportunities of digital, and how we can actually improve our quality of care and reach more patients and physicians.
Okay, yeah, and I think that's really the goal, right? I mean, the idea is to try to reach as many patients around the world as possible. And certainly to do that, we need to accelerate what we're doing within the physician ecosystem as well. And that, you put 2 and 2 together and get certainly 5 on that one for sure. And so tell us a little bit more about the kind of best-in-class methodologies that you're using, and what is pricing excellence? We've heard about we've heard about clinical excellence, we've heard about certainly launch excellence. What is pricing excellence? Tell us more about that.
Yeah, pricing excellence, the analogy I use, Stan, is nothing transformational, right? It's basic hygiene, right? Or maintaining discipline. So the analogy I use is like exercising. Everyone knows maintaining health is important, and the way to get better health is through exercising and maintaining the discipline, right? But it's not easy to implement. So pricing excellence is similar, right? It's a series of programs and processes and capabilities that you build to have more discipline in the way you price. So best-in-class organizations, really what they do is start with having the right pricing strategy based on value, right? Historically, what we have seen in med devices is, this is what the product costs, so we need to make up X margin, that's how we launch, right? So changing that paradigm to, hey, what is the value that we are adding to the physicians, right? How is it impacting our patients? How is it impacting our economic buyers? Trying to understand through a lot of research, right? So we conduct a lot of best-in-class research, talking to the physicians and economic buyers to understand what is it they really value, right? How does it improve their clinical outcomes and quality of care? And then what is their willingness to pay, right? And more often than not, when we talk to physicians, they're like, price is not the most critical factor they look at. For them, it's outcomes, quality of care, right? So how do we make sure we start pricing based on value that we bring, and the economic savings is what best-in-class companies do, right? One. The 2 is, again, as I said, is customer segmentation. You can come up with all these great strategies, but where the rubber meets the road is, how are the customers and the sales reps coming up with the discounting process, right? So providing them with a robust, sophisticated tool of customer benchmarking, right? How similar customers are grouped together, making sure they get the right discounts. And there's a lot of factors that go into what does the best customer look like, right? You need to consider the qualitative and quantitative aspects. It's a lot of analytics, right? And crunch the numbers to start creating these groups of customers and say, this is the type of customers should get the same discounts. Like a movie ticket, right? Children get a separate price, adults get a separate price, and your senior citizens get a separate price, right? So how do you make sure you have your right segmentation and incentivize customers based on achieving certain objectives?
Fantastic.
And lastly,
Ram, really appreciate your time today. Thank you
Yep.
very much for joining us. And we will talk to you again. Anyone who wants to hear more from Ram, please do enroll in the certification at Columbia Business School. He'll be talking more about pricing strategy and managing digital therapeutic approvals. Thank you, Ram.
All right. Thanks, Dan.
Cheers, cheers. And again, to the audience, you've got all of our social media tags. If you want, and you want to follow us either on LinkedIn or Facebook or YouTube or Instagram, you've got all the social tags on the chat box. And Don't forget, again, the special discount code that you've received, you'll get an email as well to take one of the certification programs, but the one I sent over was for managing digital therapeutics approvals. And looking forward to seeing you all online, either next month or next week for the Women's Health Tech Wednesdays. A special thank you to our sponsors. Again, AARP, Moses and Singer, Metadata, Goodwin, and the Merck Global Innovation Fund and Medosity. And until we talk again, please do stay safe and stay real. Take care.